Next, in the panel, we have Director of Research, Economic Policy Research Institute, South Africa, Dr. Michael Sampson, who will be joining us from a video call in this session. Further, we have Ms. Preksha Golcha, Senior Research Fellow, Economic Policy Research Institute, South Africa. Let's welcome her with a big round of applause to join for the Policy Dialogue 2 panel session. Next, I would like to invite Dr. Somchai Jitsushon, Thailand Development Research Institute. Let's give a very big round of applause and let's invite him on stage. And last but not the least, I would like to call upon Secretary, Department of Women, Child Development and Social Welfare, Government of West Bengal, Ms. Sangamitra Ghosh. I would also like to invite Mr. Janak Raj Bhatta, Director of National ID and Civil Registration Ministry of Home Affairs, Government of Nepal, to join the session. And to take this session forward, I request the Chair, Honorable Dr. Usha Jha, to do the honors.
And secure the future of globe through the child grant. That's the most important that we really need to focus on now, and I'm happy to be chairing that session. I would welcome you all here in this session, and I would like to introduce you to my my participants, my speakers today. One of them will be from the speaking through video to you, Dr. Michael Sampson. He's the Director of Research, Economic Policy Research Institute, South Africa. Okay. And the second speaker is Mr. Janak Bhatta, Program Director. And he's from the Department of National ID and Civil Registration, Minister of Home Affairs, Nepal. And then the third speaker is Ms. Preksha Golcha. She's Senior Research Fellow, Economic Policy Research Institute, South Africa. And next to her would be Dr. Somaicha Jitsuchon, Thailand Development Research Institute. And the last speaker today would be Ms. Sangamitra Ghosh, Secretary, Department of Women, Child Development, Social Welfare from the Government of West Bengal. We would be, the format would be that we will have a video presentation by Michael, and other will be directly making presentation, and then after the presentation, we will have some time for question and answers, and then you can put your own questions, and then we can discuss about that. And then formally we will close the session. So that's how we would move. And we would very much talk around the experiences from different countries, and what are the current plans that is happening in Nepal, and how can we make it better. So we would be discussing about all these things, and we would remain around the child grant and the benefits to the family and securing the future through child grant. I would like to introduce my first speaker to you all. He's Dr. Michael Sampson from EPRI, and he's a global, he's based in Cape Town. This is a global research institute based in Cape Town, South Africa. He has 34 years of experience working in social protection and specializes in designing, implementing, monitoring, and evaluating social protection systems, programs, and policies. And his experience in these areas includes work in 41 countries in Africa, Latin America, Asia, and the Pacific, as well as many related books, journal, and articles, and other publications. So now I think you can see him there already. Not there. I can see him here. Now you will see him there, and as he speaks, the slides will move. So you will see him talking, and then you can see the presentation on the slide. So enjoy the presentation from Dr. Michael. Welcome, Dr. Michael.
Good afternoon. Thank you for the opportunity to participate in this conference from a distance. I wish I could be in Kathmandu with you, but I had pre-committed to teach in a social protection course here in Stockholm. So I'm participating by video conference, and I've pre-recorded this presentation to preempt any connectivity glitches. I'm going to talk about the global experience on child grants and child benefits and how they can contribute to Nepal's social and economic development. The next slide encapsulates my key message. Child grants better enable the government of Nepal to achieve its vision of a prosperous Nepal and a happy Nepali. An extensive global evidence base demonstrates how child grants around the world strengthen human capital development and achieve developmental outcomes, helping to deliver for the people of Nepal a greater sense of well-being.
Oh, what's wrong with that?
Apologies for that technical error. We wanted to sync whatever Mr. Michael is delivering according to the presentation. So we're trying to sync that.
Good
Please.
afternoon. Thank you
have
for the
patience.
opportunity to participate in this conference from a distance. I wish I could be in Kathmandu with you, but I had pre-committed to teach in a social protection course here in Stockholm. So I'm participating by video conference, and I've pre-recorded this presentation to preempt any connectivity glitches. I'm going to talk about the global experience on child grants and child benefits and how they can contribute to Nepal's social and economic development. The next slide encapsulates my key message. Child grants better enable the government of Nepal to achieve its vision of a prosperous Nepal and a happy Nepali. An extensive global evidence base demonstrates how child grants around the world strengthen human capital development and achieve developmental outcomes, helping to deliver for the people of Nepal a greater sense of well-being and developmental impacts that can drive Nepal's future prosperity. The next slide illustrates how this evidence base demonstrates impacts across 14 of the 17 Sustainable Development Goals. I could talk for hours about these, but I want to focus on one in particular. The next slide documents a relatively new theme coming out of all places, medical research, with medical researchers weighing in on a topic they rarely talk about, global economic policy. Recent research, particularly in cognitive development, demonstrates how investments in early childhood, in particular those supported by social protection interventions like cash transfers for children, can help to build the cognitive capital, can help to rewire children's brains so they grow into more productive adults who are better able to contribute to the social and economic life of their nations. This next slide is clinical data derived from an analysis of how neurons multiply in the brain in the first 7 years of a child's life. Look at that light blue line. That's hearing, how hearing cognition develops in the brain in the first few years of life. You can see how that curve peaks in the first few years. Similarly, the dark blue line, vision skills, not the eye, not even the optic nerve, but the part of the brain that is responsible for processing visual stimuli, mostly develops in the first few years of life. All of those curves, quantitative analysis, peer social skills, language that enables the child as she grows into an adult to better represent her future productivity to a prospective employer, habitual ways of responding, emotional control. I'm not a medical doctor. I'm not pointing to the right part of my brain. I just want to illustrate that all of these key capabilities depend more than anything on the nutrition, on the care, on the resources, on the stimulation, on the protection this child receives in the first 4, 5, 7 years of her life. This next slide illustrates how that turns into an economic rate of return analysis. Nobel laureate James Heckman has demonstrated that investments in pregnant women and in the first 2 years of a child's life produce the most extraordinary economic rates of return. John Hoddinott has estimated that investments in nutrition can generate returns up to 18 to 1. And what's interesting is that this evidence, while it's relatively new, the brain has been working this way for about 800,000 years. What's new is what drives the wealth of nations. If we go back a quarter of a century, a quarter of a millennium, 250 years ago, Adam Smith wrote The Wealth of Nations, arguing that nations grow rich through commerce. 100 years ago, my country, South Africa, grew rich with the gold and diamonds beneath its soil. And 50 years ago, countries in Southeast Asia, the East Asian tigers in China, began to channel unskilled labor into a manufacturing base that drove the most massive wealth creation process the world has ever seen. But today it's different. A college dropout taps at a keyboard and births an internet company that grows to a market capitalization of hundreds of billions of dollars. Today, the wealth of nations is driven by cognitive capital. And cognitive capital cannot be traded, it cannot be mined, it cannot be arbitraged. It can only be carefully cultivated through investments in pregnant women and in early childhood. This next slide shows us how investments in social protection programs, particularly cash transfers for children, enable households to spend more money on food. And this next slide shows the resulting impacts from evaluations around the world, in South Africa, in Mexico, in Nicaragua, and Colombia. These programs are particularly powerful in achieving important nutritional outcomes like reducing stunting. And the South Africa evidence demonstrates that they also promote better gender outcomes. The impacts for girls are twice as big as for boys. But if we look at the right side of that graph, we see a caveat. It didn't work in the Honduras because these benefits are not magic bullets. They need to be integrated with other developmental interventions in order to achieve impact. I'll talk more about that in a minute. We see on the next slide that these programs help promote school attendance, in part, as we see on the next slide, by reducing the prevalence of child labor. Child transfers, child benefits enable households to protect their children, to provide for their needs without sending them into the labor market. And what is perhaps more surprising is that these benefits enable households to better participate in more sustaining livelihoods. This slide here tells us how South Africa's labor force responded to the expansion of the child support grant. It did not create dependency. No, it enabled households to better search for work and better enable them to find employment. Similarly, this next slide shows the impact for smallholder farmers. The child support grant enabled these farmers to become more resilient in two ways. Because they knew they were receiving this benefit, they were able to take the kinds of risks to improve their agricultural productivity. And when the household did face a shock, the benefits better enabled them to deal with that shock without losing their land or their livelihood. The next slide summarizes the global evidence from Asia on the link between social protection, including child benefits, and labor productivity. We see a powerful correlation. This is not causality, but many other studies have demonstrated this causal link. Child benefits enable households to manage their risks. It enables them to invest resources more effectively in more sustaining livelihoods. And there's a further effect. Social protection shares the benefits of economic growth. If we go to the next slide, we see the example of Mauritius, that 6 decades ago was as poor as any country in Africa, with a vulnerable monocrop economy subject to shocks. Over the past 6 decades, Mauritius has grown faster than any country in Africa, and today has the lowest poverty rates on the continent. Why? The next slide presents the results of the International Monetary Fund's study on what explains the Mauritian economic miracle. And one of the key drivers is that social protection benefits enabled the government to share the benefits of economic growth and put in place the kinds of economic programs that transform the economy into high growth, export-led economy. The next slide has a further caveat. It shows how cash transfers on their own, this is an example from Bangladesh, do not necessarily achieve the powerful impacts required, but they can synergize with other kinds of developmental interventions, like behavioral change and others, and multiply the impacts. The next slide draws further evidence from Ethiopia of the same effect. Social protection benefits, including those that reach children, when they interact effectively with health and education and agriculture, they can achieve a range of sustainable development goals. Those blue dots represent districts in Ethiopia where these synergies do not work well, and additional spending on the health sector does not achieve much impact. But those blue dots represent districts where synergies work, where social protection and health and education and the Women's Bureau and agriculture work together to achieve developmental impacts. And further investments in these sectors are far more productive. I want to summarize with 3 key messages. First of all, the main purpose of child grants and other child benefits is to create better well-being, to deliver children's rights. Evidence from around the world document how delivering rights can help achieve Nepal's vision of a happy Nepali. But we also see that these benefits are powerful enablers of human capital development. They drive the kinds of resources, cognition, ability to deal with the labor requirements of the 21st century that can lay the foundation for Nepal's future prosperity. And they build the resilience of households. They enable short to medium term impacts in economic growth. And they can build social cohesion, which lays the foundation for investor confidence, further multiplying these benefits in terms of Nepal's prosperity. Thank you.
Thank you so much, Dr. Michael, for sharing these global evidences, and they are really from so many countries, and I think we can really take lots of findings. For Nepal, I think it's very important that you have really shown the relation between the child grant, their right getting their rights secured, and then leading to happiness. So I think that's a very important part of your findings, and I appreciate that. And especially the crisis in Nepal is the school attendance and the child labor. And the finding is really very much targeted to that it increases the school attendance and also the child labor. So I really, there are lots of takeaway from the findings which you have given, and it's going to contribute to the social protection drive of Nepal in future. Thank you so much, Michael. Now I would like to move to the next speaker. My next speaker is Janak Bhatta from the Ministry of Home Affairs. He is now with the Department of NID and Credit Registration and as Program Director for Social Protection. He served in the past as Chief District Officer. Currently, he is overseeing 5 major cash transfer programs targeted to the most vulnerable population: elders, disabled, single women, widows, and endangered ethnicity and children. So I think endangered ethnicity and icons. So I think he is going to make the things very real from Nepal, and you would hear the real story. What is it? He's the right person to do that. And he has been given the topic about he would be talking about Nepal's Universal Child Grant, the program vision and early impacts. So let's hear from him. Thank you.
Thank you. Honorable Dr. Usha Jha, Member of National Planning Commission, Dr. Michael Sampson, Director of Research, Economic Policy Research Institute, Dr. Somchai Jitson from Thailand Development Research Institute, Mrs. Sangtha Mitra Ghosh, Secretary, Department of Women, Child Development and Social Welfare, Government of West Bengal, all the distinguished guests. It's my pleasure to be here this afternoon and highlight some of the ongoing efforts regarding expansion of the child grant and other social protection programs in Nepal. As Director General could not attend this program because of his family emergency, I would like to talk on behalf of our Director General, Mr. Deepak Kafle, and the Department of National ID and Civil Registration. Nepal has various social protection programs which can be categorized under social assistance, social insurance, labor and employment related investigations. Among them, the social assistance program covers the cash transfer programs such as old age pension, disability allowances, single woman allowances, widow allowances, endangered ethnicity allowances, and the child grant. These major cash transfer program targeted to most vulnerable population and are being managed by our department and implemented through local government. Today in this session, I am going to give you a brief update and highlights particularly the child grant in Nepal. The child grant was started 2009 and 2010 from 5 districts of Karnali region, which was universal for all children under the age of 5 years. In addition to this, the government has also started the same type of grant for Dalit children under 5 years of age across the country. After learning some positive impacts such as increased birth registration, contribution to household level food security, contribution in improving the nutrition status of children, and also to improve the families to seek other services. Government has decided to scale up child grant gradually in all the districts. As per the commitment made by the 15th periodic plan, we are aiming to have national coverage within next 5 years. We have also developed an expansion strategy to reach to the all under 5 children within next 5 years. For this, we need to invest about 11 billion rupees in addition to what we are investing at present. At this time, the child grant is implemented universally in 14 districts out of 77 districts in Nepal, along with the grant for Dalit children across the country. Currently, about 700,000 children are covered by child grant. This year, government has allocated 1.5 billion Nepali rupees to expand the child grant, which will include additional 320,000 children. Most probably, we can include 6 or 7 more districts in this year. Despite encouraging results, we still have some challenges in terms of effective implementation and delivery of the grant on time, as this is a new program, and we have realized that we need to capacitate the local government to deliver effectively and monitor the program. We have used the social protection mechanism to support the affected people of 2015 earthquake in order to provide additional top-up cash grant. Learning from the past experience regarding emergency cash transfer, we are better prepared to cover additional population in case of disaster. As part of our preparation, we are developing the standard operation procedure for the same, and we hope we will finalize it very soon. To sum up, I would like to highlight that the expansion of child grant will not only help to reduce malnutrition and child poverty, but also increase birth registration and overall child well-being. As a result, we expect these children, when turned into adult workforce, will be more productive, and the nation will be able to reap the benefit of demographic window and support the aging society. In addition, this will also help Nepal to move towards shock responsive social protection system. Thank you.
Thank you, Janakji, for a very clear information on what Nepal is doing in cash transfer, and you have very well described about the cash transfer to the different targeted population here in Nepal, and how would this child grant, it's not only the child grant, but it is really building the human capital. That's the future of Nepal. So I think that's, and thank you for this clear information. And I think Preksha, the next speaker, would add to the information given by Mr. Janak, and she would be talking about the early impacts of the program. And let's hear from her. I would introduce Preksha to you. Miss Preksha Golcha is a lead social policy advisor at the Economic Policy Research Institute, a global research institute based in Cape Town, South Africa. She has 9 years of experience working in social policy and specializes in vulnerability assessments, system review and designing, monitoring and evaluating social protection systems, programs and policies. Her experiences in these include work in 20 countries in Africa, Asia and the Pacific. So I think her presentation would be an asset to us to move forward. It's over to you, Ms. Preksha.
Thank you very much. Good afternoon, everyone. I want to just add on to what has just been said about the Child Grant Program in Nepal. With support from UNICEF, we have recently completed a baseline study and conducted an early impact evaluation of Nepal's Child Grant Program. I am going to briefly present an overview of the methodology and then focus on some of the most important findings. I have deliberately not kept this presentation technical, so if you have questions about the methodology, I'll be happy to take them later. So in terms of the timeline, we conducted the baseline in June, just last June. We gathered data on a range of issues that I'll come and discuss a little later in 20 districts that the grant, in 14 districts where the grant is already implemented, and an additional 6 districts where the grant is expected to expand to as a universal transfer in the coming year. We expect an inline evaluation that will be a more comprehensive impact analysis to take place 2 or 3 years down the line. Our study sample is basically, geographically, we covered the 5 districts where the grant was universalized in 2010. These 3 districts where the grant was universalized for children under 5 in 2016. 6 districts where it was universalized only this July, that is prior to our data collection, after our data collection was complete. And these additional 6 districts, which we call type 4 districts, where we hope the grant will be expanded to in the coming years and before the end-line analysis takes place. This is not a pure baseline, or we didn't have a pure baseline for this study because the grant has already been implemented, and I'll talk about the implications of that shortly. I just want to present the sample size to you. We have about 4,000 households in the baseline sample. But this impact analysis focuses on type 1 and type 2 districts, where the grant was universalized already in 2010 and then 2016. So we are looking at only these 2 types. What we did with the sampling, I think it's important to note this before I dive into the rest of the presentation, is for type 1 and 2 households and 3 and 4, we had a base sample of 2,000 households using probability proportional to size, but we oversampled children aged 3 to 4 years in type 1 and 2 districts, and we oversampled children aged 0 to 2 in the pure baseline districts, which is type 3 and 4 districts, so that at end line, we can try and see the difference between early and late receipt of the grant. That's why the sample size is, I would say if you look at, you have a lot more 3 to 4 year olds in the sample for type 1 and 2 districts that we actually conduct this impact evaluation, this early evaluation for. We use a reconstructed baseline because, as I said, there is no baseline available for the child grant. The grant has been implemented for about 10 years now. We used recall data, and we collected data on 2 time points. One is at the time of the birth of the child, and also at the time of the 2015 earthquake. Now, the reason we captured these 2 points is that in 2016, when the grant was expanded in the 3 type 2 districts, 2015 gives a good reference point in addition to the child's birth, which are both important life events, and you tend to have better recall. We used a propensity score matching technique to match households in order to assess the potential impact of the child grant. Once the households are matched, once the beneficiary households and non-beneficiary households are matched, we look at the mean of outcomes in the 2 groups to see what impact the child grant might have had. This was our conceptual framework for the child grant. We did not expect in this early impact analysis to see any long-term impact, simply because the duration of the study is not long enough, and because we don't have that big a sample to assess some of these dimensions at this stage. The full sample of 4,000 households, when it's available at end line, we'll have a stronger chance at a stronger power to look at some of these indicators. We do hope to see some of the long-term outcomes, not on long-term indicators like stunting, which are also very power hungry because we have a small sample at this time. But we were hoping that we'd be able to see some impact on wasting, stunting, access to healthcare, uptake of education, and things like that. We also hoped with some apprehension that we might be able to see some results on empowerment of women. Moving on to the impacts. We were pleasantly surprised at what we saw, and with very robust models, that there has been significant reduction in the incidence of moderate underweight, severe underweight, as well as moderate wasting. we see that especially among the poorer households, households in the sample that are that have below median income, you see they have households belonging to beneficiary households are 13% less likely to have children who are wasted or underweight. The one surprising result we found is that we saw an actual increase in severe stunting among beneficiary households. I mean, they had higher incidence of severe stunting among beneficiary households, which we did not expect to see. I want to, however, raise that we look at that result with caution for two reasons. One, it's a very small sample that you're looking at, but more importantly, in this sample, if I remove the type 1 households, which historically have had extremely high levels of stunting in Nepal, the significance doesn't, the result doesn't hold. For all of the other indicators, for wasting and underweight, it holds for type 2 districts alone as well, which are the bulk of the sample. But the stunting results do not hold. I also want to highlight that impact on stunting, we didn't even expect to see, and I don't think it's fair to look at this point because stunting begins in utero. To have an actual impact on stunting, you have to invest in the mother before she conceives. And that actually has an impact on whether or not a child is stunted. If you want to see the impact on corrected stunting, once a child is already stunted at birth, you have to give it a long enough duration of interventions to actually see impact. So to expect to see impact in the first 2, 3, or 4 years of life it's extremely unlikely to see it that early. More likely at age 8 or 10, you'd be able to detect that impact, and this, especially with this sample size. We did see extremely good improvements in terms of the time spent with children, particularly the amount of time fathers spent with children. There was almost an 80% increase, or over an 80% increase in the number of activities fathers engaged with their children, and also the total number of activities the mothers, fathers, or other household members engaged in with children. Now, in the sample of young boys, we also saw that the time that they were left unsupervised with another child or without an adult was much lower among beneficiary households. I think this is probably the most important impact, and I think speaks volumes to what a child grant of this small amount also given to women can do for women belonging to extremely poor households. We saw a significant increase in women's agency, self-determination, their ability to control their own lives, and the key decisions. I'm only presenting a few of the indicators here, but we've seen impact on decision-making, key decision-making for households, their decisions on how empowered they feel, on how much more likely they are to actually say no when they want to say no, across a range of different actions and a range of different themes, from expenditure on healthcare to their own occupation and things like that. There has been, if you look at the poorest households, you'll see the impact is much greater. And that is expected because that it is a much higher share of their consumption or income. The grant value is much higher. The utility is likely much higher in those households. We also see similar improvements, in terms of women believing that it's okay to say no to their husbands or their partners for when they ask for intercourse, or actually being able to say it. I think they're two different indicators. That's why I wanted to present both. Not only do they feel it is okay to say no, they are also now more able to say no. And this is extremely important for impacts that we hope to see on children, because and we know this, we've seen it in a host of studies that have been published, that women as primary caregivers have less decision-making power, but they are also the people whose definition of self-interest includes children. They are more likely to spend on the interests of the child, and thus giving them the power to make these decisions is more likely to translate to improvements for children. I think the child grant in Nepal has done that fantastically well. One very important finding, which is robust and a little concerning, is the reduction in the PNC uptake among beneficiary households. We have actually in our sample seen that the number of postnatal care checks reduce or is lower among beneficiary households. And a couple of reasons that came out in our extensive qualitative component of the study is that across all the districts that we went to and conducted focus groups with or key informant interviews with, access to a health facility was a big problem. Most importantly, transport. Getting there was a problem. If you have to walk 2 to 3 hours to get to a health facility, get there and find out that the doctor is not there, or they don't have the medicines you need, or that they're not open, even though they're supposed to be, is a big deterrent to accessing these facilities. Almost all of the study sites we went to, there was at least one woman who reported either herself or excuse me, or knowing someone who has delivered their child while on the way to the hospital. These are factors that I think show the importance of ensuring adequate systems and services that enable the cash transfers to generate impact. Now, coming towards the end, 2 success factors that I want to highlight. One is the fact that the power with local governments to move around the implementation plan, to loosen the eligibility criteria, to provide incentives has worked wonderfully to ensure uptake. In some cases, they go door to door to deliver the cash, which women otherwise would not access. And I understand that this could be a challenge in terms of administrative processes, but in this case, it has shown to actually ensure that households get the grant when they should. Challenges, the biggest challenge we found was timeliness of the transfer. Predictability is a key component of success for cash transfers. And bulk of the households reported receiving their payments in full, but in back payments, not on time. Policy implications and a few things that I think are worth considering as the government plans to expand is ensuring regularity and predictability of the transfer for it to enable and generate impacts on things that are more regular, like uptake of education and healthcare, where you can't wait for 3 months to make that payment. Also, the size of the transfer. Rule of thumb is broadly accepted as 20% of average household income or consumption, but in Nepal, it stands at about 2% of our sample and about 1.9% of bottom 20% of Nepal's population. I think it is also important to consider expanding the grant to pregnant women to ensure impact on stunting, or to enable impact on stunting and increase the likelihood of that. Also, quality, accessibility, and consistent supply of services. For example, we've seen the impact on uptake of healthcare. And if services are not available, if they're not accessible, a cash transfer cannot generate impacts. It's not enough alone. It's very important to develop systematic linkages that enable cash receiving households to also access these services, access to knowledge, access to health, access to education, access to schooling. And as a result, I think it'll be extremely useful to look at linking the cash transfer directly with access to these services in multiple ways that exist to ensure that the transfer can generate impacts. Thank you very much.
Thank you so much, Preksha, for your findings, which is quite early in sense. And but I totally take the part of the findings, like we have lacks of roads, and then we hear so many stories where babies are delivered on the way to the service center. That's very true and real. And then we also see there is a lack of birthing centers and the quality services. So these are the things that has been realized, and I'm happy that you have brought it as a part of the finding. And you have this adequate cash transfer can really help combat these things to some extent, that woman who is really pregnant and who is really developing the future for the globe has a secured a place where she can deliver a baby, and country gets a good human capital. Thank you, Preksha, for this findings, and I'm sure we will build on those findings. Next to this is from Thailand, Mr. Somachai Jitsuchon. I know I'm not pronouncing it well. He's a researcher from Thailand Development Research Institute, and he would be talking about Universal Child Grant, the key features and lessons, which is again going to help us. And to tell about him, I think he's currently a research director of inclusive development at the Thailand Development Research Institute. He specializes in macroeconomic policies, macroeconomic modeling, computer general equilibrium models, and economic models, theories, and empirical applications of poverty and income distribution, inclusive growth, social protection, and welfare system. His past experiences include being a visiting researcher at the Economic Planning Advisory Agency, Tokyo, Japan, and special lecturer at various leading universities and public agencies in Thailand. He has served in many government and private committees and director boards, including currently as a member of the Monetary Policy Committee and the National Reform Committee on Health. Dr. Somchai receives his doctorate in economics from University of British Columbia, Canada. Over to you, Dr. Somchai.
Thank you much, Madam Chairperson. And good afternoon, ladies and gentlemen. Today I'm going to talk to you about the experience of Thailand in introducing the child support grant. And we think that we can consider Thailand as a successful case in this area. And I will talk about why we think that I would try to identify some 3 to 4 success factors. But before we do that, how we move this? Sorry. Right. Okay, sorry for that. But before I talk about the success factor, let me just give you a brief background. For the moment, the child support grant in Thailand, the money is given to people, the children in so-called the poor family. Poor families meaning that there's an income threshold of about 100,000 baht per person per year, which is roughly about $3,000 per person per year, which is about 3 times of the poverty line. So you can see that the income threshold is relatively high, and it covers children up to 6 years old. But before we move into this point, we have a history of 4 years. We already have this program about 4 years, and there has been a rapid expansion of the coverage and of the level of benefit as well. In the first year, in 2015, the coverage is only for children under 1 year old, and the benefit is 400 baht per month per student. Less than about only 1 year after, there has been the expansion of the coverage up to 3 years old, and increase in the benefit from 400 to 600. 600 is roughly about 1/5 of the poverty line. So you can see that the amount of the grant is not that big, but you can see later that is actually create a difference. And according to our expectation, because of the expansion of the income threshold up to 100,000. At the moment, the coverage of the children will be greatly increased. We expect that about 3 to 4 years from now, the coverage will be about half of the children, of the Thai children in Thailand. So we are not there yet, meaning we are not universal yet, but we are on the way towards universality. Let me talk about the success factor. The first one is that we have been generating the evidence since almost day one of the implementation of the program. This is from the help of many partners that involved. We have the UNICEF, we have TDI where I work for, we have the EPRI. Plexi is here, Michael Sampson is also here. They help us a lot in doing the evaluation. We also have some other partner domestically as well. And this is quite a big evaluation. It costs about $3 million US dollar in the last 3 years. So it's quite big. What we tried to evaluate the impact. What are the child support grant make the difference to the children, to the family, and to and as well. And we also do the targeting assessment, whether or not, because this is still targeting program. So we evaluate whether or not you target the right person. And the third one we do is a process review. And I will go through briefly about the result. In terms of the impact, we found at least 4 significant impacts. First of all is on nutrition. We found that the children who receive the child support grant tend to behave or tend to perform better nutritionally. Looking at the wasting, the incidence of the wasting is lower among those who benefit, who receive the grant compared to the comparable families. And the impact is more pronounced when we look into the poorer household, for example, the extreme household, whose income is about half of the poverty line. The impact is more notable. And the same thing can be said about the breastfeeding. The breastfeeding, we also found the impact that family, the mother who received the child support tend to breastfeed more, and this is more pronounced in the poorer household as well. Similarly, the purchase of the infant formula is lower in the poorest household, and we also found that in terms of the access to the service is better for the family, for the children who receive the grant. We look into the postnatal visit. We found that the incidence is higher. And the last one that we found is the women empowerment. We found that the mother who received the money tend to have a better control over the money, especially in the purchase of the food, of the day-to-day food. So that is a good sign. So you can see that even if the money is not that big, it's only 1/5 of the poverty line, but it actually did make a difference. The next one that we look into is the targeting assessment. We found the exclusion error to be around 30%. 30% is not high by international standard, but it's still 30%. The reason for this, there are many reasons. For example, there is an uncertainty about the eligibility, because in the first year, the Thai government used the proxy beam test, which has required the 5 conditions to meet the proxy beam test, and those 5 conditions are somewhat controversial, and it creates uncertainty around who would be eligible, who are not eligible. So there's some uncertainty around that. And also in the first or second years, there's an uncertainty of whether or not the child support will be continued. Because at first, government just announced it's year by year. So there's some uncertainty whether or not the program will continue. Because of this reason, we suspect that because of this reason, that might explain the 30% exclusion error, which I said earlier is low by international standard. But this is still significant. Why is it significant? Let me talk about the third success factor. The third success factor, the second success factor is about partnership in the advocacy. In Thailand, we do advocacy a lot. We join hand in hand with UNICEF, the international organization, the academic world, the CSO, the media. We all join hands together in trying to advocate this, and we think that we are successful. Because I don't have much time, so I won't talk too much. But briefly, we established the so-called the CSO Coalition for Social Protection, which consists of mostly the NGO. The NGO will be the one who drove the advocacy with help from the academic, from UNICEF. We provide the information from our evaluation. For example, the fact that the exclusion error is 30% has been used by the CSO, by the coalition, and it proved to be a very forceful, very effective means. Because when you say that, well, you see, out of 100, there's still 30 people of the poor people who are not receiving the child support grant. And because we are advocating the leave no one behind, 30% is still too much. is still hard to accept. So the coalition tried to promote the universality, and they talk to so many people, they talk to the media, they talk to politicians. Early this year, we have the general election in Thailand, and the CSO managed to meet with almost all major political parties at that time, and it ended up to be all major political parties invent a campaign, election campaign, which include universal child support grant. So I think that this is a big success. In a nutshell, as of now, we are not there yet. I mean, the child support grant as of now is still targeting. But as I said earlier, that all the major political parties who are currently the government, the coalition of the government, they all campaign for the universal child support grant. So I think that it's just a matter of time. Maybe 1 year, 2 years from now, the child support grant will be made universal. So I think that, so I want to conclude that we can consider the Thai case as a successful one, as a successful case, both in terms of the evidence generation and how to use those evidence in advocacy. So I end my presentation here. Thank you very much.
Thank you so much, Dr. Somchai. It is really a great sharing from the experiences of Thailand's universal grant, and I'm sure there are so many things that we would need to take from your experiences and your lessons, and also some of the challenges which you shared. I think this improved nutrition is something that we would always want to get linked to, and you have that result, and you have shown that as and again access to vital social services and improved maternal services, and then the productive gains, which is always long term. So when I was listening to you and all the speakers, I could see that we are really working on all of the SDG goals. And the first speaker said that we are touching 14 out of 17 goals, and we are there. And we have been hearing from all the speakers from here. And now I would like to invite my next speaker, Ms. Songamitra Ghosh. She's the Secretary of the Department of Women, Children Development and Social Welfare. And she would be talking to us about one of the India's Kanya Shri program. And she would talk about its features, achievement, and lesson. Let me introduce her to you. Like, she's an Indian Administrative Service Officer of the 1997 batch. She has served in various capacities, including district magistrates of various districts, and has served as the mission director of the National Health Mission in the state of West Bengal. Currently, she is Secretary, Women and Child Development Social Welfare Department, Government of West Bengal, and the Vice Chairman of the West Bengal Clinical Establishments Regulatory Commission. Over to you, Sangamitra.
Thank you, Dr. Jha, and a very good afternoon to you, ladies and gentlemen. It's a privilege for me to be representing my country, India, and my state, West Bengal, before so much experience and so much expertise. Today, I will be speaking about Kanya Shri Prakalpa. This is a scheme for the empowerment of adolescent girls, which is fully funded and fully implemented by the state government of West Bengal, with a lot of technical support from the UNICEF and also from our National Informatics Center. Kanya Shri means, as many of you in the audience will be aware because we share linguistic roots, the beautiful daughter. But beautiful was not quite the situation that our daughters found themselves in 2005 and 6, when national level surveys, the NFHS 3, revealed that child marriage prevalence in the state stood at 54%, which was the second highest in India, next only to Bihar. All of these are neighboring states sharing borders with Nepal. Child marriage, as we all know, is a very gendered practice. It affects significantly more girls than boys. And West Bengal had a very significant population of adolescent girls and young women. Numbering at 13 million, they made up 14% of our state's population. Only 61% of these girls were in the 13 to 18 years age group were actually attending secondary school. And of these, we were losing 17% every year to dropouts. We were losing these girls. Female employment stood at 16%. So that was the situation that we found ourselves in. It was quite a jolt, to put it mildly. And we knew that the state's growth prospects hinged largely on the extent to which we were able to engage with this population and prepare this very vital human capital for the future. And that is how we needed to design Kanyashri, and we launched Kanyashri. This was in 2013. We weren't really doing anything very new. Several states in the country in India were already running CCT schemes which focused on the survival and the welfare of the girl child. However, there were problems in designs and implementation. We were watching them. For example, the flow of benefits in these states depended on the certification of milestones achieved, and there were numerous milestones to be achieved spread all across the life cycle, almost all the life cycle, in fact. And for example, the birth had to be registered, then all the vaccinations had to be taken, and then primary education had to be completed, etc., etc. So you can well appreciate that there were obvious difficulties in screening procedures at every one of these stages, and the numbers anytime, anywhere in India are always very huge. And the expected range of outcomes was also very, very wide. There was balanced sex ratio, then maybe better health and education status, delayed age at marriage, and also the fact that the period over which the benefits were spread was extremely prolonged, meant that both the beneficiaries and the implementers, important stakeholders, they had a very fuzzy understanding of what was actually going on in the field, of what the purpose of the scheme was and what they were trying to achieve. So these multiple stages and the multiple criteria delayed the payments, the payment transfers to the girls, diluting the message, of course, diffusing the entire purpose of the schemes, what they set out to do. Also, the absence of effective grievance redressal mechanisms meant that there was no feedback loops to inform the process. So in West Bengal, we were late starters, and we had the late starters advantage, so with a fair understanding of what would work on the field and what wouldn't. To begin with, there was complete clarity of what we in the state wanted. We wanted that our girls will have to remain in schools and colleges being safe spaces where they can learn to negotiate their adolescence for a period long enough to see off the jeopardy of child marriage. We also wanted to keep the messaging very simple. We didn't want, milestones every 2-3 years of their life. The messaging was yes to education and no to child marriage. This was indeed something that we did do new. We also targeted girls who were in the age group of 13 to 19. This was also something new. Why 13 to 19? Because this is an age when the girls are old enough to understand, to begin understanding at least the message that we were trying to put across. It's also something which is related to their immediate aspirations, to their immediate concerns. It is also a time when the girls are coming into their own, they are finding their voice. Importantly, it is also a time when they are at their most vulnerable. This is the stage at which they are dropping out of school, generally dropping off our radar. So we caught them with a safety net. You heard about the safety net and the ladder theory in the morning. So we caught them with the safety net of the CCT, the conditional cash transfers, just as the girls were stepping into their teens. We covered them with an annual scholarship. This is the scheme, as you can see. It's a two-staged conditional cash transfer. The CCT is a two-staged one. There's for 5 years, from the age of 13 to the age of 17, with an entry point at grade 8, we cover them with an annual scholarship, which is not a very hefty amount, but we do reward them with a much more substantial sum of 25,000 rupees once they reach the age of 18, having continued with their education till then and having been unmarried till then. Importantly, because we've learned from the other states, we kept the eligibility criteria for the beneficiaries very consciously at the very, very minimum. There were only really 3 things that we had to see. That the beneficiaries had to be within a certain age bracket. Second, they had to be in school. Third, they had to be unmarried. That was all. That was it. We tried to keep the process very hassle-free for the girls to the extent possible. And it was possible because the girls were already in school. They had come through some kind of a screening process. And the applications for the beneficiaries were facilitated by the school. The documentation and the certifications were kept to a minimum because the girls were already part of the schooling network. The funds that the girls were supposed to be getting were transferred directly to the bank accounts which were opened in their own names. It was their own bank account, not their mother's, father's, anyone else's. And it was an electronic transfer. There was no cash handling at any point of time in the program. The results are there for all to see. This is the simple message that we had: yes to education, no to child marriage. And these are the numbers that we are looking at. Kanyashri is in the 6th year of its implementation, and it has brought nearly 6 million girls, 5.8 currently, nearly 6 million girls under its cover. And out of these 6 million girls, 2 million girls have already reached the age of 18 without having been forced into marriage. We have 17,500 schools, educational institutions registered with us on the scheme. The scheme has handled 15.2 million transactions in these 6 years, worth about 7,880 Indian rupees, or 1.1 billion US dollars. This is an amount that a state government, a cash-strapped state government admittedly, has unstintingly provisioned for through various fiscal measures and has invested it, knowing fully well the multiplier effect of nurturing its girl children. Now, such numbers would not have been possible if we had not kept the conditions easy, as I have pointed out, the processes intelligible, and the systems accessible. As we all know as managers, simplicity in design it's the result of a lot of hard and complex work. And it was necessary for us to establish a very robust, foolproof, and a quality e-governance mechanisms when we were doing Kanyashri. Since we service 3 million girl students every academic year, and since we are handling a very significant amount of public money. So e-governance solutions were indispensable. This was something also that we did new, unlike the other states. E-governance, of course, has enabled transparency, it has enabled accountability, and cost effectiveness. We are reaching out to the maximum number of girls with the minimum effort. We've also had to regularly build capacities of more than 30,000 implementing stakeholders, which include the program managers, which include nodal teachers in each of our 17,500 schools. There were also a multiplicity of implementers in the sense that there were several government departments, all of which run educational institutions. So we've had to coordinate with all of them in order to ensure that all their schools were brought within the fold of the scheme. We also had to ensure that the beneficiaries' grievances, and all the beneficiaries are young girls, impressionable age, that the grievances were promptly attended to. We had to develop multi-channel communication material in the multiple regional languages that are in our state, in Bangla, in Hindi, in English, in Urdu, and yes, also in Nepali. And in order to ensure that the changing contours of the scheme were known to all in as real time as possible. Kanyashri is, we are confident, it will raise the mean age of marriage. It will increase educational attainment. We are expecting the results of the next national survey in December this year. And we are hopeful that child marriage rates, which had registered only a 15-point decline between 1992 to 2015, which is a long period, would be showing a much steeper fall from the current 41.6% at which it stands. Anemia, currently at 62.2%, low BMIs, which affect 38.4% of the girls, teenage pregnancies, which stand at 18.3%, in the age group of 15 to 19 years of girls that we are talking about, are also expected to come down. Of course, as program managers, we had factored in all these attendant benefits when we had designed the scheme in 2013. What we had not perhaps anticipated was the speed and the alacrity with which the girls seized upon the opportunity that the scheme provided them and rapidly transformed it into the recognizable brand that Kanyashree is today. And it is this which prompted us to move very quickly to the cash plus mode. The timing, of course, was also right. We had spent the initial years in putting the systems in place, in strengthening them, and in achieving almost universal coverage in our target group. And now in the state, we are gearing up to move to the next level, that is cash plus. We had spread the net with CCT, and now it's time to put up the ladder with cash plus. We need to complement the leverage, complement the gains that we have made to strengthen the base that CCT has already ensured. And so that we can facilitate our young women to make the transition, that is the very necessary transition from secondary education to skills development and to gainful employment. Hence, cash plus for our aspirational citizenry, as you heard in the morning. So what are the components that we are trying to build into cash plus? We are trying to create school level and community level peer groups amongst the girls. The boys are not really excluded, we are including them too. We are arranging for life skills education, which is a rights-based education. It's about soft skills development, it's about health and nutrition awareness, it's about menstrual health management, it's about financial literacy. We are arranging for exposure visits to the girls to public institutions like banks, like post offices, police stations, administrative offices, health centers, so that they know how to negotiate these public spaces, and they also know how to take advantage of the plethora of schemes that are available to them, plethora of public services that are available to them. We are also arranging for career counseling and coaching of the girls to facilitate each and every Kanyashree beneficiary's access to tertiary education or to employment or business services, helped by performance-based contracts with qualified providers. We are also planning to conduct outreach and public education activities to parents, to caregivers, and also to young men in order to generate support for young women's socioeconomic empowerment. It's quite a bag full, really. And we are facing a lot of challenges. And the challenges are much stiffer than what we faced when we were doing the CCT bit. The challenges are a little bit on the demand generation side, but mostly on the supply side, that is our side. We are struggling, for example, to identify resource persons who will deliver the life skill and other self-development trainings. We don't have enough career counselors who have the wherewithal to really assess the aptitude of the girls and channel them into gainful employment. The teachers who are most closely connected with the girls in the schools, they need to be clear about the role that they have to play in this, and they need to be motivated to play that role. That's important. The girls themselves, of course, need to be mobilized and encouraged to participate in the peer group activities. It's been a 5.5-year journey so far, and what is it that we have learned? One, that when we are aiming at universal coverage involving huge numbers of beneficiaries, huge numbers of service providers, and of course, huge public funds. In our country, all numbers are mind-bogglingly huge. It is imperative that things are kept simple. The scheme design should be simple. The messaging should be direct and unambiguous. We should not be overawing the implementers. We have to remember that there are implementers all across the spectrum at various levels. There's a hierarchy of implementers. We should not be confusing the beneficiaries. I mean, even as I say that, a lot of our beneficiaries were confused as we found out that, what to do with the 25,000 rupees when I grow up to be 18, have managed to finish school and have still remained unmarried. So the parents saw that 25,000 rupees as a reward for the admirable restraint they had shown so far in not marrying of the girls, and used it as a resource to marry off the girls once they stepped into 18. So, I mean, even after all our efforts, there was this kind of confusion. We are trying to eliminate. This confusion has to be eliminated.
Which time?
Yes. And we also have to be nimble and responsive to change. Convergence is important. That's a lesson that we've learned with civil society, with other arms of the government, so that all resources which are already there are used most efficiently. And lastly, political will has to be harnessed. There has to be a buy-in. For us, fortunately, it came from the very top with the Honorable Chief Minister herself driving the scheme. In fact, she is the one who's designed our logo, and she's the one who's pushing the girls into all kinds of high visible campaigns that are launched not by our department alone, but by all other departments. And the Kanyashri beneficiaries are now the most sought after people to champion the causes of the other departments, whether they are spreading awareness against vector-borne diseases, whether they are spreading awareness about environmental conservation, whether they want to promote road safety. There have been awards galore, international, national, in the government levels, in private levels. But of course, we all know that our biggest reward will be when our girls grow up into confident, responsible, active citizens whose values and actions together will contribute towards a more equitable and violence-free society. Thank you so much.
Thank you, Ms. Ghosh. I'm really sorry about the time. I'm sure, as you said, anything in India is huge, and she can go on and on and on. I've seen some of the programs there in India, like I was there for the Poshan program, and that was really wonderful. And I can hear this program as well, and this should be equally good. And I think yes to education and no to marriage. It's a great drive, and we need to really work on that. I know that I'm very short of time, and it's really bad that I could not manage their time, but it was really interesting, and I really never wanted to stop them. Everybody tried to manage it themselves. But then I can take few questions, 4 or 5 questions, 1 to each, and so it's over to you for your questions. Yes, sir. Mike?
Hi, thank you very much.
Identify yourself, and who are you really targeting?
My name is Nick Mathers with LSE. So my question is to our colleague from EPRI. The child grant, historically, I suppose one of the major problems has been the benefit levels, which has gone up recently, but the sort of second biggest problem has been about exclusion errors, especially among newborns and 1-year-olds, so because of delayed entry into the program. So I wonder if your research is able to say anything to this about whether there have been any improvements in that. And I think just related to that, I think the example from West Bengal perhaps strikes a note of caution with Nepal, not to maybe rush into cash plus initiatives until getting the basics right. So I wonder if any of the panel members have any comments on that.
Thank you. I think let's take question and then you can answer it. Anyone else? Yes.
Thank you for nice presentations. My name is Mansi Fali. I'm from Kathmandu University. I have a question for Preksha, who has did their research in Nepal for how the cash is like invested on the reducing malnutrition among the children aged below 5. So my question is like, what are the variables you looked at that cash is pertinently used for nutrition sort of things? Shall I explain again? You didn't catch me?
Just the question, I couldn't hear you clearly. Sorry.
I mean, what are the variables you analyze that the cash is, invested properly in the intended purpose, right?
Anyone else? Yeah.
My name is Franziska Gassmann, Maastricht University, and I have a question for the lady from the last presentation from West Bengal. It's very impressive, staggering numbers indeed. The only thing I was wondering is, so there is so much focus on the girls, and I see this is very important to empower them, to strengthen them. What are we doing about the boys? Because there, I guess, also a change of attitude needs to happen, parents and so on. Maybe you, I think you have mentioned it, but it would be very interesting to hear from you how you see that. Thank you.
One more? Okay. It should be the last one now.
Thank you for all the presentations. My name is Jasmine. I'm with the World Bank. My question I asked to two people, perhaps our EPRI colleague as well as the Thailand colleague. I completely think the information and the data is there on how when women get the cash, it makes such a big difference to themselves and the households. So I'm wondering in this case, in the research that you've shared, whether it's the cash grant that is linked to the women's empowerment and the changes we're seeing in those, or it's the fact that it's the women receiving the grant, and whether you're able to differentiate that in the work that you've done. Thank you.
Yeah. Yeah, very short. Yeah, come on.
Namaste. I'm Bimal Prodil from NFDN. My question is to Kanyashri. Did you find any parents just ignoring those programs, or you did find any parents who were just ignoring those programs or schemes and indeed involved their goals for the child marriage?
Okay, I think no. I think the questions target Preksha and you. So who will start first? You? Yeah. Okay, Preksha, you can start.
Thank you very much. So I'm hopefully remember all three questions, and I'm going to tackle all three. First, on the exclusion and inclusion issues, we did not look at whether the exclusion is improved or reduced because we only have one set of data at this point. What I can say, and it's we didn't do an impact analysis yet, and maybe at N-line we'll be able to look at exclusion better when we do the N-line. But what we did see is in the difference between type 1 districts where the grant has been implemented for about 10 years, more than 95% of the households that we went to were receiving the grant. We struggled to find households that were not receiving the grant. But in type 2 districts, our take-up rate, the take-up rate that we find is approximately 70%. Another interesting difference, which I think has policy influence, has implications for policy, is that in type 1 districts, where the grant has been active for so many years, people knew about the grant irrespective of whether or not they were pregnant or had a child or went to get their births registered. They knew about the grant before they delivered their babies. But in type 2 districts, it's only been 3 years since the grant has been universalized, and their majority of the women found out about the grant only at time of delivery or when they went to get their births registered. So I think it's also to do with awareness, less to do with anything else. I think most women who found out in the data that we have showed that women almost immediately, or their husbands, immediately applied for the child grant as soon as they found out, within 6 weeks. Where women found out at delivery, majority of them registered for the grant within 6 weeks of delivery. So I think that's all that I can give you right now from the data that we have, but hopefully at N-line we'll have more. For the variables that we looked at, we did not find in this sample any significant change in food expenditure or expenditure on non-consumption. I can only at this point give you descriptive numbers that most, and we asked a couple of questions on what they spend the grant on. The two things that I don't have the numbers off the top of my head, but I can share that with you, is food expenditure on fruits and vegetables, and also on healthcare. Bulk of the expenditure was on healthcare. on managing, taking the child to a health center and things like that. But these are the two key things. The third thing that came out was expenditure on toys for children if they needed it, or clothes, even if it's once a year, to be able to buy them winter clothes. Those are the key factors, and I can share the numbers with you. The third question was on, one more thing. There was one more that I'm missing. I know. Okay, I'll come to it. The women's, yes, sorry. I actually can look at it right now to see, but in most cases, women are receiving the grant in the Nepal Child Grant. Nobody else gets the money in their hand, right? So it's very difficult for me to see if there's a difference between the impact on if the woman receives or somebody else receives from our data. Because where we asked who receives the grant, it's always the women. So it appears that because the women get the grant in their hands, it seems to have an impact. And that's all that unfortunately, I can't make the comparison with the data that we have. Qualitatively, and from the baseline, I do have to say this, that in the type 1 households where women have been receiving the grant for a while, women are more likely to not give the money to their husbands at all. That's also the districts where empowerment levels are much higher. Women are more likely to make decisions for themselves and their children. In type 2 districts where women are less likely to be able to make these decisions and have lower agency levels, if I may call it that, there women also tend to give the money to their husband because he manages the finances of the household. That's about all that I can say at this point, but we will look at the dimension or have UNICEF see it when they do the impact evaluation, if at all husbands get the transfer in any event. But most government officials reported that they do not hand the cash transfer to anybody but the woman, the mother of the child.
Yes, thank you for the observations and the questions. The first thing about whether we were rushing into, or whether I was trying to strike a note of caution about not rushing into Cash Plus without doing CCT properly. Yes, of course, we have to be judicious, and CCTs do lay the foundation for us to build on. But as we all know that the demographic window is not going to remain open for a very long time. So we have to have a balance of rushing and, judiciousness in it. Secondly, about boys. Yes, of course, boys are important. They do hold up half of the sky. But, and we need to see that they do it efficiently. However, one or two things, social structures are designed in favor of boys and against girls. All our social protection schemes. I don't think we have very many examples of social protection schemes in favor of boys. Investing in girls are always translate into greater benefits for obvious reasons. And when we are struggling with scarce resources, as countries in this part of the world are, we naturally have to prioritize. So as of now, yes, in the state and as in India, we are prioritizing on our girls. That is not to say that we are leaving our boys behind. There are a lot of health and education programs which focus on students and on adolescents alike, irrespective of the gender. The third issue was about whether the parents are ignoring Kanyashri initiatives. Is that what you meant, sir? Yes. Well, I mean, that was one of the hurdles that we had to face. There was a lot of social messaging that went on ahead of launching Kanyashri. And it's still going on. That conversation, that dialogue with the parents is a very important dialogue that we need to, go on ahead with. It's not something that we suspend. Because it's the parents who are getting their girls married off at a tender age. So they need to be convinced. And this convincing is done best by their own daughters. Thank you.
Thank you. I think I would like to take the permission from the audience for a 1-minute question to each of the speakers. I think let's hold it and then you can ask it on a personal basis. 2? Okay, come on, yeah. Yeah. Try to be brief. It's good to be, sharing the things, but I think the time is running short. Okay? Thank you very much. Now I would just ask 1-minute question to each of the speakers and then let's hear from them. Don't take more than 1 minute. My question first goes to Michael, I can't ask him. Okay, Preksha. What explains the significant women empowerment impact of the Nepal's Universal Child Grant?
When you give cash to a cash-strapped household, where a woman is not working, she is working at home, doing unpaid care work, she's always dependent on her husband for money. If you give that woman some money, some bargaining power, and the data from the cash transfer actually shows women quote, and in most districts, I can now tell my husband no when he wants money, when he's out of cash. So when I want money and my cash transfer, my 400 rupees is over, he gives it to me because he knows he will get it from me when he needs it. That ability to have some money as opposed to having absolutely nothing, and 400 rupees is nothing, it's 2% of their consumption, and monthly consumption. But it gives them some sense, especially in the poorest household. Women feel that they have some bargaining power as opposed to none. And I think that is what translates to empowerment, and as we saw amongst the poorest households. And as that value increases, it will show impact on also slightly richer households or still below the poverty line.
Thank you. Thank you, excellent. I think I would now put a question to Janakji. How do you really ensure that the child grants are being delivered to everybody in the ward? कसरी ensure गर्ने सबैले पायो भनेर?
The child grant is distributed by the local government. In local government, they when they register the birth registration, after they will enter in our MIS system. They will enter the name of the child to the MIS system, and we allocate the budget for them, and we send the budget to local government, and they will distribute the fund to the child, and they will send us the report to our MIS system to us, and we verify the thing.
So you have a system that is ensuring that the child grant is delivered to everybody in the ward. Now to Dr. Shonchai, how is your program financed?
It's 100% tax finance, entirely from the government.
How do you really ensure that you have an interministerial coordination for your program?
Yes, we have structures in place for interministerial coordination. And right at the level of the topmost administration, that is our Chief Secretary heads an interdepartmental committee who sit together to iron out any kind of, mainly to ensure that there are nobody falling through the cracks. We also have the finance minister on behalf of the chief minister of the state heading a committee of ministers which looks after implementation of Kanyashri, brings in new ideas, especially about Cash Plus.
I would now like to extend my thanks to all the speakers. It has been really wonderful. And also thanks to all the audiences for your active participation. And really, it is really the session where we could learn a lot, and then we could really build on the learnings from the different experiences. Thank you so much, everybody here and on the floor. Thank you.
Thank you so much to all our speakers, the panelists, and of course, Chair Dr. Usha Jha for doing the chair of this particular session. And thank you so much, everybody. This was undoubtedly a very important and an interactive session that we just had. It's time for a short coffee break. We will take a 20 minutes break. That will be probably, I would like to see you all at 4:05 here dot at the auditorium. And yes, if any questions, further questions that you have, we are going to have a session tomorrow at around 3 p.m. Where we will have experts who will be interacting with you all. So you can have your questions jotted down for now and leave it for tomorrow's session as well. So I'll see you all in about 20 minutes. That is 4:05 p.m. Thank you.